Welcome to our video series called Industry Viewpoints, brought to you by the American Bankruptcy Institute. I am Bill Rochelle, ABI's Editor-at-Large. Each segment will feature an expert providing views on the current state of a particular industry with an emphasis on what lies ahead. My guest on this edition is Cynthia Romano, a turnaround manager from CohnReznick. Cynthia is one of the brainier people in the bankruptcy business because she did her undergraduate work at Brown, followed by a stint at the MIT School of Management. Because turnaround managers like Cynthia end up in industries where there are problems, Cynthia has been spending lots of time recently on healthcare. And that's what we will be talking with Cynthia about in the next few minutes. So Cynthia, let's start from here. Every day when I open the newspaper, somewhere on the front page, often and not above the fold, is healthcare.
Yes.
Now, why is that?
Well, first of all, let me start by saying thank you. It's an honor to be here. I respect your work tremendously, and it's also really nice to catch up with you again.
Well,
so
thank you.
My view on healthcare is it's very personal, and it is the great equalizer. It doesn't matter how much money you have, how little money you have. We are all facing the same fate at the end, and we are all subject to the vagaries of whatever system we belong to, participate in, and get care from. But economically, I think we would have to say that our healthcare system is failing us. We spend 16.9% of GDP on healthcare, and that is compared to 8.8% for OECD countries.
Twice as much?
Yes, and our life expectancy is less, 78.6 versus 80.7. So for the spend that we are putting out, we are not getting nearly as good outcomes as other developed nations.
So I guess we should all move to Sweden.
It's a possibility.
But they don't have enough light over there in the winter.
Possibility. So I think the reason we see a lot on healthcare, and I think the reason people pay attention to it, is we foresee our future in what we see in the headlines today.
Well now, refresh my recollection. Obviously healthcare was exceedingly important after the pandemic began, but what about before the pandemic? Was everything hunky-dory then? It was certainly not.
And in fact, much of what we saw during the pandemic, and to the extent we're in a post-pandemic era, the problems that are existing now started prior to the pandemic. Healthcare was struggling well before. Bankruptcies were on the rise, and bankruptcies were the largest growing industry sector of the bankruptcy world.
That was before pandemic.
That was in 2019.
Yeah.
And everyone was watching the trend carefully, waiting to see what was going to happen. COVID hit, and many of the problems that existed previously simply got magnified. Financial management issues, the ability to implement technology that was now part of the regulatory requirements. Reimbursement rates were declining as costs for skilled nursing were going up. So no business likes to see revenue coming down and costs going up. We had consolidation taking place. We had entrance from private equity, and there was a significant culture clash between private equity and healthcare providers. So there were a number of issues that were taking place that were driving distress well before COVID.
Oh, okay. Now, let's stop right there, because you've now refreshed my recollection, and I remember going back 3 years, people were very worried about the future of healthcare. And I must confess, when the pandemic began, I thought the healthcare system was going to collapse for financial reasons, principally, that you'd have so many sick people who didn't have insurance that there'd be no way to pay for it, and hospitals would go bust. Now, yes, there have been problems, but our healthcare system has at least survived. Why is that?
So the problems that everyone thought, as you described, were going to happen didn't really happen.
Oh, really?
As you know, they set up tents in Central Park, at the Javits Center in New York City, all over the country. Boats were brought in, assuming there were going to be a tremendous overflow like what was seen in Italy. And while every hospital was crowded and certain ones were at capacity, I don't think the influx was nearly as much as everyone predicted and expected.
But how did they pay for it?
Well, so before I get to how they pay for it, The bigger problem that took place is with the lockdowns and with the shutdowns, elective procedures were taken away. And for hospital systems and health networks, elective procedures is where they make their money. It's not the emergency room, and it's typically not the ICU. It's heart procedures, it's orthopedic procedures, it's gastro procedures, all of which shut down. People didn't want to go to the hospital shut down those procedures as a way to save space and capacity for COVID patients, and as a result, revenue took a tremendous dive.
So now it gets worse, but how did it survive?
So it survived because the government provided a tremendous influx of stimulus money from all forms. CMS provided advances.
CMS means?
Center for Medicare Services. They provided advances against AR that they normally would reimburse. And eventually those advances have to be paid back. But that was one way of providing liquidity. HHS did, I think, 4 separate grants, the last of which is going on right now, still happening. PPP money was doled out as it was to every other industry. And there was just tremendous government stimulus money that was pumped into a system where the operating metrics were either distressed or flat out upside down. And so what we saw for the last 2 years, from early 2020 through today, really, is healthcare awash in liquidity, operating metrics not necessarily perfect or recovered fully.
Oh, so in other words, during the pandemic, we treated the symptoms, but not the underlying disease.
Well, yes, although it wasn't clear the underlying disease at that point could be treated. So the best we could do was keep things afloat. We had to make sure the healthcare system survived, right?
Yeah.
And the government did that. So for that, kudos. And I think that's true of a lot of industries. The stimulus money is why many businesses are around today that otherwise would not have been. So I am in favor. On the other hand, many health organizations had more cash than they'd ever had. The question is, what do you do with your cash? Do you use it to invest? Do you use it to upgrade? Do you use it to fix the fundamental problems that were existing pre-COVID? Or do you just keep spending and eventually liquidity runs out because operating metrics have not caught up? And we've seen a mix. We've seen some systems that have done some great things with the money they received. We've seen others where I think it's a matter of time before, and it'll be a race to the finish, whether volume and revenue come back before the stimulus money runs out.
Oh, good grief. You
Yes.
know, I was worried 2 years ago at the outset of the pandemic about healthcare, but I think you've succeeded in making me more worried right now. And by the way, Cynthia, when you talk about healthcare, is it really just one industry, or are there really several industries, shall we say, under that umbrella?
Yeah, the word healthcare in my view is a misnomer. I think one cannot talk about healthcare as a single entity. It is made up of multiple different sectors, multiple different sizes, multiple different geographies, different demographics, and each of these things play a role in how well off or how not well off the organizations are doing. So for example, rural, less well-off organizations are struggling and shutting in record numbers. Systems that are centered around wealthy major metro areas, New York, LA, Chicago, etc., seem to have rebounded and are doing just fine. Inner city, other problem. It's a city, but the demographic that they serve and the payment they receive, either with no insurance or through the government, Medicaid, Medicare, is simply not enough to cover the cost of service. So there are hospitals, there are hospital systems, there are health networks, there is senior living, there is home care, there's medical devices. Each one of these has their own particular challenges as it relates to the demographic that they serve, and that is compounded by the geography they sit in and their size. Obviously, like many industries, larger companies, larger organizations have more cushion. Smaller ones, less. Rural has less options because there's less people, there's less demand, it's a very finite audience. So it really depends.
Sounds to me like your advice is, do not get sick in a rural area.
I wish that weren't true, because I really do think the rural areas need help desperately. Yeah. And we need, as a country, to figure out a way to provide service to folks who live in more rural communities.
I know, I've been reading stories about how if one, in an elderly couple, one goes in a nursing home, it may be 100, 200 miles away.
It's correct. It's correct.
Well,
and
that's cruel.
There's discussion about using telehealth, which we all took advantage of during COVID. Yeah. I had a doctor appointment. They're like, lift your arm. How's it going? How does it feel? Right? Very different experience than being in an office, but they're looking at using telehealth. They're looking at using a triage center and then airlifting people to more large scale and more diverse centers. They're talking about bringing in a doctor for a rotation. So there are a lot of solutions on the table, but the rural healthcare industry right now is really, really struggling.
Well, let me ask you this. In this country, we always like to blame our fundamental biggest problems on government, which means regulation. Is this really just only a problem of regulation?
No.
Well, if there is any problem in regulation, what is it?
So regulation governs reimbursement rates. And for the majority of people, the way healthcare is paid for is either private pay through a private or payor from an insurer. So we have insurance, we go to the doctor, our insurance company pays. But a lot of people have Medicare, right? You hit a certain age, you get Medicare as a result of all the work you put in. Medicare is reimbursed by the government, and the reimbursement rates are set by the government. Same thing with Medicaid if you are below the poverty level or below a certain income level. And presently, the reimbursement rates are significantly below where they need to be. As an example, in the senior living space, which is one of the major subsectors within healthcare and is a fate that awaits, I think, all of us in some way. What do we do when we're older and infirm and able to care for ourselves? The reimbursement rates for Medicare and Medicaid are below cost.
What?
In one state.
What?
Below cost. In
what?
One state, 68% of cost was the reimbursement rate. How can you run an organization or any business when revenue is below cost? The answer is you can't, unless money is coming from somewhere else. But even if money is coming from somewhere else, that money is being poured down a sinkhole. So that needs to be addressed. And for one of my clients, we approached a state on addressing this and said, we cannot possibly survive with reimbursement rates so far below cost per patient. And they said, we are not intending to do anything because we believe there is an overabundance of inventory of beds for senior living. And as a result, we think, while painful, this process will cull, and the culling will lead to a rebalancing of inventory and demand. So.
Well, Cynthia, I tell you, this has been an enlightening and perhaps frightening discussion. I mean, there has been so much sickness in the country for the last 2 years that, I would have thought that healthcare would be a booming business, but that's just not the case.
If I can add one thing before we wrap up, because
Yeah.
I think it's critical and it goes to your point about looking forward.
Yeah.
There are a lot of innovative, I don't want to say fixes, but panaceas for certain problems that affect the healthcare industry. There is technology, telehealth, wearable devices, and particularly for senior living, to allow people to live independently for a longer period of time. The ability to solve some of the rural problems with technology, the bifurcation of systems where specialties go to certain places so they can get efficiencies and economies of scale. There are tremendous innovative programs taking place throughout our country and abroad, which I think are really interesting to take a look at in terms of how to better serve the patient population. Private equity money is still coming in and still looking, and I am of the belief that where there is money, there is hope, as long as profits drive quality of care, right? That is the really key thing here. But there are options, and there are people trying to address these issues and solve these issues. It is not perfect, and there are definitely challenges presently and on the horizon, but I am hopeful that smart minds working together, both within the government and within the private sector, can ultimately come up with something to improve the systems we use.
I'm certainly glad you said that, because I have felt that my blood pressure just went down 20 or 30 points. So I am much relieved, and I really look forward to seeing whether and how this works out in the next 2 to 3 years. And for those of you in the audience, we thank you for tuning in. In the Industry Viewpoints series in the upcoming days and weeks, we will continue to talk with other experts about the future of industries that are affected by our turbulent economic times. Until then, be well, stay safe, and good day.